Okay, so in general cardiology, we deal with things like cardiovascular risk like hypertension and cholesterol. And in cases like, for example, heart attacks, where we find that when a person's arteries are occluded, that means 100% blocked, they get what we call a heart attack. So what interventional cardiology does is that they actually do a procedure to try to unclog these arteries to arrest the heart attack, so that to restore the flow to the coronary arteries. I think again, this is also another important question in terms of cholesterol. I think cholesterol is a very broad term. It really depends on, number one, when you look, people generally look at these blood results on the paper, and these are the ranges that we talk about cholesterol, but it doesn't segregate whether you're an 18-year-old girl versus an 80-year-old octogenarian lady, and whether it takes account whether you have other contributing cardiovascular risks like being diabetic or hypertension. Certainly, if you, for example, as we grow older, if you have concomitant coronary artery disease such as diabetes, hypertension, high cholesterol becomes far more important, and there are certain targets that we try to achieve for these patients. When you are young and you are sporty, you are doing sports, I think being younger, you're allowed to have a higher cholesterol. So I think that it's not just a broad term of who has high cholesterol, who doesn't have, but I think that's where the doctor-patient relationship in terms of individualization for patients and discussing the pros and cons of using healthy lifestyle modification versus using the need for pharmaceutical intervention will come into play. I think in our day-to-day practice, we do see a large spectrum of various sorts of presentation, from classical Hollywood movie types like acute chest pain on the left side, or what's more common is like shortness of breath. But shortness of breath, again, is a very vague term because many people attribute it from excessive work, lack of exercise, and them trying to get back to. I think shortness of breath, chest pain radiating down to your left arm, to your neck, these are the classical signs that we tend to be warning patients of. In the past, we used to use medical therapy for people with hypertension. There are some groups of patients which are deemed what we call resistant hypertension, whereby they actually require more than 3 different agents to try to control the blood pressure. Fortunately enough, with recent research and technology, they've come to understand that within the kidneys itself, our day-to-day fight response is actually supplied by this sympathetic nerves, and this new technique of what we call renal denervation can help certain subgroups of patients. These are patients where we can actually use a catheter-based procedure to try to what we call ablate, which means burn using sound waves to burn the sympathetic nerves around the kidney arteries, and that has shown quite favorably in recent times to lower the blood pressure quite considerably. But certainly it's not a procedure for everyone, but I think again, this is something which it has to be properly looked upon, and then to discuss the pros and cons of the procedure. But definitely it's a promising procedure which will definitely help a subgroup of patients. I tell my patients that I wear the hat of a cardiologist by day, but after work I'm as much as a sports enthusiast like everyone else. But I think the key statement which I usually tell people, everything in moderation. Some people tell me that drinking wines ablates alcohol, but what happens to people who cannot tolerate alcohol? Does that mean that they have a higher risk? I think in life, generally everything in moderation, in terms of exercise in moderation. Even if you do marathons in excess, that causes structural changes in your heart, which actually will be detrimental to your cardiovascular health. In terms of alcohol, I think again, a glass of wine doesn't do much harm, and in fact will calm some people who work extremely hard. But that's again for people who can tolerate alcohol. So I think generally in life, I think the bottom line is everything in moderation if possible.